Hello everybody, I'm Dr. Erica Ditzler and I'm here with Dr. Jack, and today we're here to talk to you a little bit about preparing for an emergency visit. So as many of you may know, I'm an emergency doctor at VRCC, so this is something that I have a fair amount of experience with. So one of the first things that I can talk to you guys about is being prepared by bringing in any sort of medications that your pet is on when you come to visit us. So the first reason we like this is so that we know the name, the type, and the dosage of the medication that your pet is receiving. So even though you might know the name of an antibiotic like Clavamox, there's a lot of different dosage of that. So it's nice for us to know what exactly your pet is receiving. And just describing it as a little white pill or a little green pill, we might not have an idea of what you're talking about specifically. So always bring those medications in. And if you are giving them anything else, so supplements or over-the-counter medications that you were giving them because they weren't feeling well, bring that in as well so we know what they're receiving and if we should anticipate any sort of drug interactions with treatments that we might want to do here in hospital. The second thing to bring and to prepare getting together is any medical records that you have on your pet. So even if this is something really basic, so just their vaccine record, what their annual visit was like last year, bring that in so that we know if your pet is A, up to date on vaccinations, and B, what they've been vaccinated for, so we can potentially rule out some certain diseases and not go barking up the wrong tree essentially. So those things are important. If you don't have copies of those and it's during normal business hours, you can always call your vet office and ask them to fax or email over to us any diagnostics, so x-rays, blood work, etc., and then their whole medical records. So that can help us with diagnosing and then treating your pet. The other thing that we do recommend is preparing for this ahead of time. So get this all together, and then that way, if you have to run out the door in a hurry, you have it, or if you're going out of town, you can hand it to your pet sitter, and they know everything about your dog, can bring it in, and we have all the information we need if you're not present to tell us about it. The other thing that's nice if you're going out of town to prepare is have a signed form saying that your pet sitter has permission to make medical decisions for your pet and even financial decisions if that's what you wish. So we have a little bit more security with going forward with treatment. Also list on that any emergency contact numbers, so specifically for you of course, but maybe a family member or a close friend that we might be able to contact that you feel would be able to make some medical decisions for you. The last thing that we want to talk about is making sure that your pet actually gets to the emergency room safely. So once you get here, make sure that their collar is fitted tightly. I know I personally fit my collars on my dogs pretty loose at home, but just tighten them up a little bit so that they're secure, so they don't pull them off with a leash if they're tugging a little bit when they're nervous, or make sure that their harness is fitting them appropriately for us, just to make sure their visit is safe. If you have cats at home, make sure that you get them here safely as well. So we don't recommend bringing them in a towel. If you have a pet carrier, that is our #1 choice to put them in. But something else that works really great is boxes actually. So you can put the kitty in a box so that they can't pop out, and also so they're not as nervous in the waiting room. The other options you have is a small cage or even a basket with a lid on it. You can make that a little cozy environment to get them here safely for us to examine them. If you guys have any other questions about how to prepare for an emergency visit, please let us know, or you can always call the closest ER clinic to you and ask them if you have any specific concerns. Otherwise, thank you guys for watching, and post any questions that you have below in the comments.